Hello, friends, and welcome to episode 1237 of the Juicebox Podcast. Radwa is an ophthalmologist from Egypt whose son has type 1 diabetes. Her husband, a surgeon, also has type 1. Today, we're going to talk about access to technology, costs around type 1 diabetes, and much more. Please don't forget that nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan or becoming bold with insulin. When you place your first order for AG1 with my link, you'll get 5 free travel packs and a free year supply of vitamin D. drinkag1.com/juicebox. Are you a U.S. resident who has type 1 diabetes or is the caregiver of someone with type 1? If you are, please go to t1dexchange.org/juicebox and complete their survey. Doing that helps in so many ways. It's hard to list them all here right now. Takes you about 10 minutes. t1dexchange.org/juicebox. You will be helping people with type 1, probably be helping yourself, and you'll definitely be helping the podcast. Thank you so much for listening. I hope you guys do that. Let's get to Radwa. This episode of the Juicebox Podcast is sponsored by the only implantable sensor rated for long-term wear, up to 6 months, the Eversense CGM. EversenseCGM.com/juicebox. Today's episode is also brought to you by Touched by Type 1, and they have a huge in-person event coming up soon that is completely free for you to attend. Check out touchedbytype1.org for more information and get your absolutely free tickets to their event that's happening very soon in Orlando, Florida, that I'll be at, and so will Jenny.
I'm Radwa, from Egypt. This is how I would like everyone to know me. I've been following your podcast for about a couple of years. I'm an ophthalmologist, practicing one, and I teach in Cairo University. My husband's an orthopedic surgeon and a type 1 diabetic for around, from my elderly son's age is from 15 years. And I have a 5-year-old type 1 diabetic. He's been diabetic for almost 4 years now. And definitely my look at, although I'm a healthcare professional, I'm an ophthalmologist, so I'm really oriented with diabetes and its complications, but I've looked at diabetes differently since my son's diagnosis. It's been an eye-opener for me about what we're missing here in our country, the things that we need to have but we're not having, the proper management of diabetes,
Mm-hmm. Let me ask you a couple of questions and we'll dig into all of it, okay?
Okay, go ahead.
So you and your husband have been together for how long?
We've been together for almost 20 years, 5 years before we got married, or 4 years before we got married, and then we've been married for 16 years.
Okay. And did he have type 1 when you met him, or did he develop it after you were married?
No, after we were married. While I was pregnant with my first son. I don't know why it was a shocker for him, because they have a strong history of diabetes in their family. His mom had this, she's a type 1 diabetic when she was 27.
Mm-hmm.
This is what we call the maturity onset diabetes of the young, moody. And then he had his both siblings are diabetic. His younger brother had it since he was 2 and his sister since she was 10. But he was the only one in the family who didn't have diabetes. I think he thought he passed that,
Yeah, he got away with it.
Yeah, but he didn't. He got it at the age with same like his mom, he had the exact same gene.
Yeah, in his mid-20s he got it.
Yeah.
Okay.
Yeah, he was 26.
Okay. All right. And I want to ask you, when he's diagnosed and you're pregnant at that time,
yeah,
and then you look at the rest of his family, do you think, oh, my kids are going to get diabetes?
Not really.
No.
But actually, we always had that in the back of our minds, even before his diagnosis, it's in their family, so they definitely might pass it on. And we always had in mind, my elder kids, they don't have diabetes. I have a 15-year-old and a 12-year-old girl and a 15-year-old boy. But whenever, for example, they had an accident during sleep, or we think they're drinking too much water, or they pee a lot, we immediately check them at home. So it was always in the back of our mind,
Yeah. Have you ever had them checked for antibodies?
no. And I, I don't know why, but I don't want to do that. I'm like, if it happens, it happens,
Okay.
like we have to have a healthy lifestyle in general. We don't overdose on sugar as much as as much as possible.
Hmm.
But I don't want to go and check them for antibodies and just make them live with it in the back of their mind. Like, you have the antibodies, so you're going to get diabetes at some point, you know?
I hear you. So, okay. So he's diagnosed. What's his care like? And are you involved in it at all?
No, I wasn't really that involved. He's a doctor. His mom is an endocrinologist, actually, but an adult endocrinologist. I don't know why I didn't give it much thought back then. Like, he's an adult. He knows what he's doing. His hemoglobin A1Cs were around 6.5 to 7.5. So, yeah, he's doing okay. And his mom is like all over him.
Mm-hmm.
So I thought that was enough. But, after my son's diagnosis, no, it wasn't enough. And I'm all over him now.
His mother was on him about it. How was her management and her kids even?
They went MDI, okay,
Mm-hmm.
he used Lantus and Novorapid, and it worked fine for him. And he didn't have a sensor, continuous glucose monitor. He didn't have one. He blood checks his blood sugar like 5-6 times a day. He can feel the hypos and he can feel when it's high, but he just checks it 5-6 times a day. And to be fair, we don't have CGMs in Egypt. We just had the Freestyle Libre 2 years ago. And only the first generation.
Oh, really? Just 2
Yes.
years ago. Just 2 years ago, you got 3 generations old Libres.
Yeah, I know.
Right.
And we still, up till now, we only have the first generation. It's not even available all the time. Like, when I started to get him the Libre, when I heard about it, I got it from another country. Like, I have a friend. I'm like, can you bring me this with you when you're coming? And he brought him like 2-3, and they were like eye openers for us.
Yeah. So did he learn that those 5 checks a day are not telling the whole story?
Yeah, he knows. He actually knows, but he's a busy surgeon. He doesn't give it much thought, if I would say that. He just likes to eat healthy. He goes to the gym. He checks his blood sugar 5-6 times a day, and he thought it was like, it's okay. But definitely when he had the Libre, he had much, much better control for his blood sugars.
Yeah, just wearing a few of them helped him. Okay.
Yeah. But at that point, we never heard, like, he thought having a pump would be a bit handicapping to have it stuck on him most of the day. Because also in Egypt, we only have Medtronic and like the older versions. Okay.
Yeah. Oh, and so there is an access issue for everything.
Yeah.
Yeah.
A big access issue. I tell you, I flip over backwards to get my son the Omnipod,
You're not going to be the first person I've spoken to from, oh, wait a minute. I was going to say from Egypt, but maybe that person was from Saudi Arabia who told me this story about, like, they actually get on a plane and fly here and buy it, then fly back again.
Yeah.
That's
basically, like, I didn't even have a prescription for my my husband's still MDI till now.
Mm-hmm.
He's like, because, we have to pay everything out of pocket. We bring the Dexcom from London. Okay, because we have him registered there and we have several friends who live there. So I just buy it online, send it to their home, and then I buy like 6 months altogether.
Mm-hmm.
And then whenever they're back on vacation, they bring us the stock. So the Dexcom is easy. The problem is with the Omnipod, because usually you need a prescription for it anywhere.
Okay.
There are some few like websites in the States that outsource them. So we found a trusted website, and this is what we've been using for a while. I also order online and send to my friends, and I have several friends who live in the States. But recently, we're on the Dash, okay?
Mm-hmm.
The low on the stock of Dash, it doesn't have any Dash. That was a big problem for us until eventually I found that Omnipod have, a couple of months ago, in Turkey, in Istanbul, they have a company that's called MedSalus, I think, that outsources the Omnipod from the company itself, and they can work with an Egyptian prescription. So this is what we're doing right now. I fly to Istanbul to bring the stock and come back.
How far of a flight is that?
No, it's just a couple of hours.
Just a couple of hours. You're going to be extra mad when your kid's older and doesn't appreciate anything you did for them.
It's okay. Like, I take it as a chance to go and have a 3-day vacation, and then buy the Omnipod and come back.
I have to go get your pump. Bye-bye. Get away from this for a couple of days.
But yeah, we do have to bend over backwards to bring his stuff.
Yeah. Tell me why doing that was so important for your child. I hear what you're saying about your husband. Well, I guess maybe the question is, could you afford to do it for both of them if your husband was interested? This episode of the Juicebox Podcast is sponsored by the only 6-month wear implantable CGM on the market. And it's very unique. So you go into an office. I've actually seen an insertion done online, like a live one, they recorded it. The entire video is less than 8 minutes long, and they're talking most of the time. The insertion took no time at all, right? So you go into the office, they insert the sensor. Now it's in there and working for 6 months. You go back 6 months later, they pop out that one, put in another one. So 2 office visits a year to get really accurate and consistent CGM data. But that's neither here nor there for what I'm trying to say. So this thing's under your skin, right? And you then wear a transmitter over top of it. Transmitter's got this nice, gentle silicone adhesive that you change daily. So very little chance of having skin irritations. That's a plus. So you put the transmitter on, it talks to your phone app, tells you your blood sugar, your alerts, your alarms, etc. But if you want to be discreet for some reason, you take the transmitter off, just swoop, comes right off. No, not like peeling at it or having to rub off adhesive. It just kind of pops right off. This silicone stuff, really cool. You'll say it. And now you're ready for your big day, whatever that day is. It could be a prom or a wedding or just a moment when you don't want something hanging on your arm. The Eversense CGM allows you to do that without wasting a sensor, because you just take the transmitter off, and then when you're ready to use it again, you pop it back on. Maybe you just want to take a shower without rocking a sensor with a bar of soap. Just remove the transmitter and put it back on when you're ready. EversenseCGM.com/juicebox. You really should check it out.
No. He's interested, but I think it would be very tight, and we don't want to go there because, we buy everything in dollars. And to give you some perspective, we're having a major economic crisis in Egypt nowadays for the past couple of years. And like $1 was around 15 Egyptian pounds. Now it's at 50.
Oh my
You
gosh.
understand?
Wow.
Yeah. And it might get worse. Like, there's no stability there in the horizon up till now. So we don't want to get stuck with having both of them on Omnipod, and then we have to remove him from it if we go into financially we can't afford it, so he doesn't want to start that. Yeah, and he doesn't want to go there.
So make sure I understand correctly. If something costs $600 American, that's 600 times 50 for you so it's 30,000 Egyptian pounds.
In my currency.
Yeah,
Yes.
in your currency. And I'm sorry, this is a weird thing to ask. You can say I don't want to tell you. But I mean, you're a doctor, he's a doctor. How much do you make a year?
In dollars?
Do it in pounds.
I can't.
How about not you, an average?
Yeah. I can't tell you by year. I can give you by month an average.
Mm-hmm.
In Egypt also, you need to know that the medical field, most of it is private. Yeah, your work is a private section. I mean, it's not like in the States. You don't work for a hospital and you have a paycheck every month. No, you work in several hospitals and it all depends on your flow. So it's really variable between a month and the other,
Okay. So just give me an average month for a doctor.
For a doctor, no, it varies a lot. I could be I'm not working. I stopped doing any surgery since the diagnosis because you can't have both of us scrubbed in, and then the school tries to reach out and nobody answers,
Mm-hmm.
So since my son's diagnosis, I've decided I'm not going to scrub in anymore. I'm working only as a clinician, a medical retina and ocular inflammatory diseases. I can make around only this is so embarrassing.
Why? Don't be embarrassed.
The number in dollars is really embarrassing. But $1,500, for example, a month.
A month?
Yeah.
Oh my gosh. And that even...
Yeah, but my husband is definitely it really varies. It depends on how many surgeries he had this month, but he can be 10 times that or 5 times that,
Mm-hmm. At that 1,500 number, that's 75,000 Egyptian pounds. And then the pumps alone and the Dexcoms you could work all month to buy supplies for him.
Yeah, my husband honestly covers that. It's not me. Yeah, we can afford it. It exactly costs us around $3,000 a year.
Okay.
A year? $3,000 a year for the Omnipod.
Right.
Okay. And $3,000 for the Dexcom.
Okay.
So this is what it costs a year for us.
Wow.
In average.
So at the current Jesus, is that right? At the current exchange rate, it's 6,000 times 50?
Yeah. Don't go there.
No, I'm going to. This is kind of fun. Oh my God.
No. Okay, you can do it like, actually, we have also, it's very complicated. It's like in the bank, it's times 30, but in the black market, it's times 50 because the bank doesn't give you dollars because they have a defect in it. It's very complicated.
Oh my
you know?
gosh.
Like the difference between the banks and the black market is almost 20 pounds.
Yeah. All I heard was that you're a doctor and you made $1,500 in a month. And
No.
I
Please
think,
don't go. I think you need to edit that.
I think everyone, listen, I'm not kidding you.
No, I can't have my friends listen to that.
Well, they know, they know you could be doing the other work and making more money, but you're doing this thing for your kid, which is lovely. But I'm just saying that people here should, like here in America, and they should have some perspective is what I'm saying. You know what I mean?
Yeah. But on the other hand, like definitely the cost of living here is cheaper, like, I mean, if you come from America and you have like $2,000 on you, you could like live well.
Wait. For how long? How long could I make it on $2,000?
It depends on where you go out and what you eat. And it's very complicated.
Seriously?
Okay? we have all, yeah.
Radwa, I'm on my way. I mean,
you don't have to live here, but I mean, if you come here on vacation, it will be a really cheap vacation for you.
Really?
Yeah.
I'll finally be able to live like I'm rich for a couple of minutes, you're saying?
Yeah.
Oh,
exactly.
Man. All right.
But overall, I mean, the cost of living in Egypt is definitely cheaper. Most of the people in Egypt, we own our homes. We don't have mortgage, or rent. Most of us.
What's a home cost?
Sorry?
What's a home cost?
It like went like 10 times up in the past 3 years. So also don't go there. Like right now, you can't afford to own one. But yeah, it's very variable. It depends on how big the home is and the area.
I understand. There's a lot of variables.
We're all about the economic.
No, there's a lot of, I'm super interested in this. So there's a lot of variables, but what do you think an average person lives in a home that costs them what?
Like you might have bought the home for only like, I don't know, you do the math for like, you bought it for 1 million, for example, but right now it's worth 6,
Oh, okay.
Like,
and
so
1 million,
when you bought it.
1 million British pounds.
Egyptian,
excuse me.
Yeah.
And so that would be divided by 50 for 20 grand.
Yeah, but you'd have bought it for more than 20 grand because $1 was actually 7 when you bought the home.
Okay. But
so
then that's $100.
It's very complicated. Don't go there.
But then that's $140,000.
Basically.
I'm telling you right now, you can't buy a box with a broken window here for under $300,000.
Exactly. I know that.
In New Jersey, where I live. Like, I'm sure it's different in other places. Don't get me wrong. But so I could bring $2,000. I'm just planning for myself. I could bring $2,000 to Egypt and have 50 times that. I could have 100,000 Egyptian pounds. I would feel, do I carry it in paper in my pockets like Scrooge McDuck, or how do I do it? Is that a reference you know?
I think we should start this podcast over.
No, I'm having such a good time. So we'll get past that for you. But
it's okay.
No,
Okay, go ahead.
I just wanted to paint the picture because somebody who's not a physician is not flying to Istanbul to get Omnipods. Right. So most people there are living with MDI, and if they're lucky, a Libre 1, but probably not. Is that pretty accurate?
Yes.
Okay.
Yes. If we're talking about the average human in
Egypt,
in my country, we don't have insurance. Actually, we pay medical care and schools out of pocket. Most of the people that have money. People who don't have money go to public schools, but they're not really getting like that good an education. Mm-hmm. And the insurance would only cover the MDI, not even the Libre. Okay?
Enough to keep you alive. And then what about the care? What are people, because if doctors are cash pay, then most people are probably just getting their insulin and their needles, and then they're going off. And
there are people who work in like multinational companies or in good companies, and they have insurance. We as doctors, we don't have insurance. Mm-hmm. We have the syndicate, but they cover very little of whatever cost you go through. A lot of people, they have insurance companies covering for them, but I think most of them would only cover MDI.
Okay.
Wouldn't cover a pump, or only if you have like a really, really good insurance, they would cover a pump for.
Is the insulin expensive there or no?
No, it's very cheap.
Very cheap. Okay.
Yeah. Like, and come and buy like your stock of insulin and fly with it, and you won't believe how much it costs.
Well, wait a minute. Maybe now I'm coming. I come with my 2,000. I get 100,000 Egyptian pounds. I spend 500 Egyptian pounds on insulin. I come back here and I'm rich with the insulin. I sell it on the black market over here. Is this what you're telling me I should do?
Yeah, you might do that.
Why can't I do that?
A pen of Novo is around, it was 100, now it's 160 Egyptian pounds. So you do the math, it's like $3.
God,
right?
Damn, that's something else. Okay, now you piss people off. Now that I don't feel bad for you anymore. Never mind.
Yeah, exactly. It's very different here. Like the story of my son's diagnosis, I think this would be one that.
Well, tell me.
That's not a common story, but it was at COVID times. He was diagnosed on the 7th of April, 2020.
Mm-hmm.
And like I told you, we always had the diagnosis of diabetes in the back of our minds. We had we had the lockdown on 17th of April, on 17th of March here in Egypt, and he had a party at his nursery the day before. I think he caught the hand, foot, and mouth disease.
Yep.
So we spent the first week of the lockup. He had a fever and the vesicles in his mouth, and he lost weight, and it was okay, and it passed. And then the week after, he was just so agitated most of the time. He lost weight, but I'm like, yeah, he wasn't eating for a week. We're locked down. It's a different situation for him, and he's only a year and a half. He can't express himself, so maybe that's why he's not himself. But then what caught our attention was his diapers were filling really fast. I was sitting with my husband. I'm like, I can't change his diapers enough, every 3 hours, and I think he's just full like a balloon. And he's like, okay, why don't we do him a test? Like we did with his siblings, like when everybody had an accident, just come and do a blood sugar. And usually it comes out fine and we're good. So we did that. And oh my God, his blood sugar was 400. So I'm like, no, something is wrong. Let's wash his hands and do that again. And it's 450. We tried his toes. It's still high. So we knew, he has diabetes.
How did that strike your husband? Do you recall?
It struck him really bad. Yeah. I thought it would strike me worse, but no. Yeah, I mean, he didn't fall apart. He was very helpful. He was there with me in every step, but no, it hit him really bad. We had a long bout of depression after it.
Do you think he feels like it's his fault?
No, it's not that. He's just, look, I'm a very religious and faithful person, and he is too. He believes in God and everything, but he just why did this happen? I have in my back of my mind, everything happens for a reason, and you just have to live with it, and God will be with us. He's like, no, why did this happen to my son?
Yeah.
He's too young. This shouldn't be happening to him. He was struggling with that, more or less.
But he didn't feel that way for himself when it happened.
No.
For him, it was God has a plan. I'm okay. That kind of stuff. When it happened to his son, he was angry. Yeah.
I
understand.
So what we did was okay, his blood sugar is high, so he has diabetes. Should we go to a hospital? What should we do? And then I called my dad, and I'm like, and I called my friends. Do you know a good endocrinologist? I have a friend whose son is a type 1 diabetic. I asked her who's he's following with. Long story short, somebody sent me this pediatric endocrinologist number that they think she's really good. I called her over the phone, and she's like, no, you don't need to go to the hospital. I think you can manage him at home. Check his acetone. He did not have acetone at the time. So she's like, I think you're really early in the diagnosis, so you can do this at home. And I kept texting and talking to this endocrinologist over the phone and on WhatsApp for 2 weeks. She was living with us, but she didn't see him. The first time she saw him was 6-7 months after his diagnosis, when everywhere it opened up, and I took him just for a regular check. She told me all the labs that he needs to do, and we had the lab come over at home, and we did everything. But, we did not have this dramatic experience of going to the hospital and being admitted. We just did everything at home. She's like, go on, buy the Tresiba and the Nova Rapid, give him blah, 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 do him a diabetes diary, what he eats, how many carbs, and so on. And she started to tell me what a carb insulin ratio is and how I should try to calculate it. And we did all this at home. Definitely us being locked down at that point was very helpful.
Yeah, I imagine.
We had nothing else to do,
We'll just focus on this since we're just bored out of our minds. Does the insulin need a prescription? She said, just go get insulin. Was it that easy?
No, we don't. We don't, most of the drugs in Egypt, you don't really need a prescription for them.
Okay. I could just roll in there and be Be like, hey, I want to try this. I want to try this Ozempic. Make me thin. Give it to me. Is that easy?
Yeah, Ozempic. Because we're low on stock, you might need a prescription, but it's not because you have to have a prescription for it. It's because they're low on stock, so they don't want people abusing it.
I am coming to Egypt to be skinny and rich. This is it.
You think that, but that's not.
Yeah. What?
That's not how it works.
That's not how it works. I'm making it work that way. That's what I want.
But yeah, you can like there's this other drug, I can't remember its name right now, that's like the Ozempic but came out before it.
Mounjaro?
No, we don't have Mounjaro.
Trulicity?
Trulicity, yes, and there's this other one that's cheaper. I can't remember the name right now.
Oh gosh.
Like, this one is available and you can just go and buy it.
No kidding.
Okay.
All right, I'm coming. I'm on my way. Like, seriously. I mean, what the heck? Why are you living so... What's the downside of Egypt that I don't know? What's going to happen when I get there? And I'll be like, oh, this wasn't worth it. Or no. Lovely place?
Like, if you come on vacation or come to live here?
Yeah, I don't know. Whatever. What do you think?
There are definitely a lot of downsides.
Oh, okay.
Like, I'm telling you, I'm a doctor and I make $1,500 a month.
I guess that part is, I'm going to have to bring all my money with me.
Downside.
I have to bring all my money.
But there's other downside. A lot of other downsides. Like, definitely schooling system, for example. You'd have to go take your kids to a private school to get a good education. So you have to pay for it. And you, like, for example, in the States, when we went there, if you want to go to a good school, a good public school, you have to live in the area where they allow you to go to the school. And usually this area, the rents are higher, the houses are more expensive, Mm-hmm. So it's like, instead, you have to pay for the school here in Egypt. You can go to any school you want, but you have to pay for it.
I see.
Because the public schooling system is not very, I don't want to go there.
Mm-hmm.
Let's focus on type 1 diabetes.
I gotcha. All right. I have to ask, are you expecting your children to be doctors?
No, I don't want them to be.
How come?
I come from a family of doctors. Like both my parents are doctors and my husband's too. But recently, even in the States, everywhere in the world, it's become very challenging to become a doctor. I mean, the working hours, the expectations. I don't know if you're feeling this around, but lately, doctors are not given the respect that they should be having, like they did before, like 20 years ago,
mm-hmm.
I don't know if you feel that in your country, but there is a lot of problems with the healthcare system everywhere. Yeah. Like in Britain, they're struggling with it. In the States, our friends, they're struggling, like everybody is. So I think to be a doctor, you have to really want it and love it. It's like, I don't tell them you can't be a doctor. I tell them it's your choice, but they have to really, really want it and ask for it to be able to do the work, because it takes a lot of work to be a doctor.
What other professions, when you think of your kids, do you hope for? Because here I think kids now, I think there's this study that says that young people in America, if you ask them what they want to do for a living, they say they want to be a social media influencer.
Most of them. Yes, like my son at some point, he's like, okay, I want to be a YouTuber. I'm like, no, this is not a job. This is something that you can do on the side.
I said to my son at one point, I'm like, if we're all influencing everybody, who's making money? We need somebody needs to do something.
Yeah, it's something that's going wrong with the world since the social media opened up that big. And it's definitely frustrating for the kids to watch, like, okay, my dad is a doctor, but this football player or this influencer, they live a more luxurious life and they make 10 times more money, So it's not very intriguing for them to become a doctor anymore. Like, my dad works 18 hours a day and he's always scrubbed in and he's not available. And now I can be a YouTuber from the comforts of my home and make more money, Eventually
that won't work out.
Yeah, I think this is what gets into them. But no, I think there's a lot of professions. Like, I'd love for my son to, for example, become an architect.
Okay.
I think they do, he's an artist. He likes to draw. And I think it's nice that, designing homes and designing buildings. And I think that's an interesting profession.
Yeah,
but
I got you.
Whatever. I'm not giving it much thought right now. Like, I just want him to get good grades and then we can see where we go from there.
Well, I just realized I'm never coming because the flight is 14 hours. So I'm not doing that.
It's not that bad.
Yeah,
I've been to the States several times. Like, I'm jet lagged right now when I'm talking to you because we've just came back from our Like we had a Christmas vacation at my cousin's in New York, and the flight is not bad. Maybe the jet lag is the problem.
Is the problem? I'll definitely throw a clot and drop dead on that flight.
And you don't have to take you can do transit flights. Like if you go through Europe, so you'll have a 7-8 hour flight and then another one that's like 3-4 hours and you're here.
Okay. All right. I don't know.
And New Jersey is practically close.
This feels like when people ask me to come to Australia. I'm like, no, that seems it's very far away. I'm not doing that. Like if I could fall asleep in a pod and wake up in Australia, that might be different, but I don't know. Put me to sleep. I want to understand when your son's diagnosed, and how do you get from where you described with your MDI and learning at home to I need to find a CGM? Like, where do you even learn about those things, first of all?
First of all, as for the CGM, we have a friend who was on the Dexcom. So it was like, yeah, you need to have that for your son. And we had a friend who's in London, and he mostly did it all for us. He registered him, and he brought us the Dexcom like a month later when he was coming. The doctor told me it's preferable to have a CGM. The only thing that we have in Egypt right now is the Freestyle Libre, but I was like, no, it's not good enough. And then our friend suggested the Dexcom. He was on it. He used to bring it from London. Like we had him on Dexcom like just a couple of months after his diagnosis. And we only stayed on the Dexcom for 2 years, Dexcom with MDI. With the first week of diagnosis, what I did is I sat there and started to search for Facebook groups, like Facebook support groups. Like I told you, I wasn't really involved with my husband, and I wanted to know more. I wanted to listen to people talking about it. I wanted to ask some questions. So I just started searching for Facebook support groups. I found several ones. I didn't find actually the Juicebox Facebook group at that point. But then people kept bringing up the Omnipod. And then one of them said, there's this Juicebox podcast that's very useful. The podcast kept coming up like in the comments from different people. I didn't ask any question, just kept reading questions and comments, trying to educate myself a bit. So I put that in the back of the mind, but I was at home. And at that time, I usually listen to like audiobooks or podcasts during commute, during going to work. So I didn't think about listening to the podcast at that point, but I put it in the back of the mind. I went there and followed the podcast, but I didn't start listening at the point. And then when people started bringing up the Omnipod, I'm like, yeah, I need to know more about that. So that's when I started looking into the podcast because people kept recommending it. If you're going to put on an Omnipod.
You know, it's funny. I'm so happy that worked out, but I don't think of it that way. I don't think I talk about anything on this podcast that you couldn't do with MDI, a T-Slim pump, a Medtronic pump, or anything else.
Yeah, I know. But they said that it's useful, like
because I have those pro tip episodes so this was like 2 summers ago, like August of 2022. Is that about when you found me?
I found you before, but I started listening in 21.
Okay.
I guess by the end of 21. Started like listening randomly. At that point, I didn't want to put on a pump on a 2-year-old who's running around because the pumps we have available here are the ones that you have to like have an inner pocket for it with him and it's cannulated.
Right.
And I was like, no, I can't do that. I'd feel very uncomfortable if it got stuck in something or hung up on something. It would be handicapping for him. So I went along with MDI. And then when I read about the Omnipod and I found that he can like go to swimming class with it, that there is no cannula involved. And I was like, okay, this is what I want for him. But I don't want to change the system that his nursery has been used to. Like they give him the injection in the nursery and everything. And I just keep following with the Dexcom and giving them instructions. This is how it's working. Like in the nursery, it's an open community. You can call at any time. It's not like the school premises. So I can drop off anytime I want. And if I need anything, I just call the teacher and tell her like, oh, he's going high, give him blah, blah, blah. He's going low, give him juice and so on. And
they'll do all that. And nobody fights you about it or says that's not my job or anything like that.
No, his nursery was very helpful. The teachers were amazing. And then we had to go to school. And that's when I was like, he can't be on MDI in school. He can't keep going back and forth between the doctor's office and his class for every injection or for every whatever.
Yeah.
The summer before he went to school, I was like, no, I have to get the Omnipod. What I actually did is like I ordered the Omnipod and I had it like since April. I've had like a 6-month stock that we bought.
Right.
And I kept looking at it. I'm like, what I'm going to do with that? Like, how I'm going to do this? So, okay, I'm just going to postpone this to the summer. I don't want to change his system right now. And I shut it off. And then when I talked to his endocrinologist, he's like, yeah, the Omnipod is really good. I've tried to help one patient before with it, but I can't really remember. I'll check it out and come back to you. I'm like, no, I can do that. You know?
Yeah. I don't need your help.
Yeah, if she's going to have to check online and ask around and then come back for me, like I can
If
do
you're
that.
Googling, I can Google. Also, I'm a doctor too, by the way.
This is exactly what I did. Like a friend, like she pushed me to do it. She's somebody I got to know because her kid is diabetic too. So we have like this small community. We communicate with each other. So she told me, like, we did the Omnipod at home. Her husband was totally in charge and he was able to do it. So I'm like, if he can do it, I can do it. So I took a week off. I stayed with him totally at home. I read all about it. I watched all the videos. I'm like, okay, I'm doing that.
Mm-hmm.
So I kept him at home. Even my husband wasn't available at the time. He was like in a conference and it was only me and my kids at home. I decided to put it on. I put it on and I had already listened to several like several podcasts, and I watched several videos and the instructions of how to do it. And it just took me like 3 days to get his basal right.
Right.
I think most of the struggle was in the basal. It's the Dash, it's not the Omnipod 5.
Mm-hmm.
So there was no algorithm involved.
Yeah.
And we got there, and I watched his numbers getting really good. And I was like, I kept telling my husband, you have to get some for yourself too.
Well, that's what I was going to ask. Like, as soon as you start seeing the benefit of it, do you turn to your husband and go, hey, what are we doing here for you?
Yes, exactly. But up till now, he's still resisting. And he's like, just let's keep all the money to get him a steady supply of Omnipod. Because it, like, right now, if he doesn't have the Omnipod in him, I don't think I'll send him to school, you know?
Yeah. It gets scary, doesn't it?
Yeah,
Once
it's
you're
a bit
accustomed
scary.
to it. Yeah.
And his teachers won't, honestly, in school, his teachers won't give him the injection. They're not allowed to. So I wouldn't feel comfortable him going back and forth to the clinic every time. But his teachers, they would use the Omnipod easily.
No trouble.
We have a WhatsApp group, me and the teachers.
Yeah.
And I keep giving I told them, I'm totally in control. I'm going to give you all the instructions whenever I need to. And this is what we do. Like, right, I just send them on the WhatsApp. Right now, he's going a bit low. Can you give him a biscuit? Or we have his supplies in class, or Skittles, or a juice box, or whatever.
Right.
And if he's going high, I send them, like, give him 10 grams of carb or whatever. So it's easy for them. They just press bolus, put a number, press OK, and that's it.
Is it hard for you to know that you guys are making a financial decision that, I don't want to say it's hurting your husband, but is it hard to know that you're making like a Sophie's Choice decision? You're like, we're going to give it to, I mean, I guess most people do this.
Definitely. Yeah. Definitely. But you work with what you have, you know?
Your husband sounds like a good guy. I'll tell you right now, this
he is a good guy.
Yeah, you're not able to get mad at him now because of this. This is very selfless.
He is selfless, honestly.
It doesn't work that way though. You're married. You can still be mad at him. It's fine. And so
yeah, but other stuff. Not
not this one thing.
But generally, like, yeah, it's a choice. But like you said, it doesn't feel like we're harming him. It's just like he has better options that we're not using right now.
Mm-hmm.
You know?
No, he sounds like he's on top of his situation. So I don't think he's being harmed. I'm not saying you can't do well with MDI and testing. You certainly can. It makes the point really that you're having to make a decision. There's a thing you'd like to do and you can't, and that it's not just, it's not just in one country. Those problems exist everywhere for the most part.
Exactly.
Yeah. And they're happening to you, two doctors, which is not a thing people would expect,
Yes. Yeah. It's not common. But the healthcare system, like I told you here, is so different. Like, it has a lot of privileges. Like, if you want to do an MRI, you just go and do an MRI, you know? Like, if you know you need one, you can just go and do it.
Are they financially, like, difficult to get?
No.
Healthcare, so it's not monetized the same way?
Yeah, healthcare here is very different. It's a lot cheaper. You don't have to, like, ask permission and wait. Like, for example, if you want to have an elective surgery, bypass, for example, to lose weight. You can do it the next day. Like I know the waiting list, for example, in the UK is around a year and a half to do that.
Mm-hmm.
Or if you want to do a hip replacement, you might have to wait for your turn. Here, you can do it just the next day, even through insurance, you know?
Because there's availability of doctors, or because, why do you think that is? Why do you think there's that instant access?
Doctors are much more available. It's not like that there's a lot of doctors, but the doctors are available. Like I told you, I handled my son at home and I had my doctor on WhatsApp. And my patients can reach me on WhatsApp anytime. Like if they have an emergency, if they need to ask about something, they can just text me and I answer back.
Mm-hmm.
You know, it works really differently here. Like you could just go and book an appointment and go.
Yeah.
You don't have to go, for example, through a primary care doctor. We don't have that here.
Mm-hmm.
And then he decides if you need to see an endocrinologist or not. I think there's an episode I was listening to a few days ago, and she was talking about the struggle to like diagnose her kid. And they kept in the ER sending her back home with COVID, sending her kid back home with COVID. But like here, you would have not just an ER doctor, you would have like whole specialists available if you go to the ER at any time, you know?
You know, I found myself laughing earlier when the doctor offered to Google Omnipod for you and look it up. But I actually thought later, I should know.
She knows Omnipod and she worked with it like once, but a couple of years before. So she's like, I can't remember what we did back then. I need to recheck.
Yeah, but I laughed and I shouldn't have, because what I should have saw was a person who was willing to tell you, I would like to help you. I don't know what I'm doing. Let me go find out about it and I'll get back to you. Whereas I think that I hear a lot of doctors here just either pretending they know what they're talking about or just ignoring you if you ask something that they don't, or they would say something like, oh, don't use that pump. I heard it's no good. When what they really mean is, I know how to use this one. So let's stick with that.
We definitely have, like this person was saying before podcast, doctors are humans. Like you can find a mean one and a kind one and a helpful one and an egoistic one, you know? So what I was like referring to here in Egypt, the doctors are more available for the patients. Like they're not somebody that you have to go through a whole lot of system and paperwork to reach. You could just
call them up.
Doctor.
Yeah, call them up and say, my ankle hurts. Could you look inside of it and find out what's wrong with it?
Yeah, not all the doctors, of course, are that reachable. Some are really more busy. Some like their ego makes you go through like his secretary or personal assistant, or like they have a waiting list or whatever.
Yeah.
But I mean, generally you can reach a specialist that you want to go to like in no time.
If I needed LASIK surgery and you were still doing it, I call you up and I'm like, hey, I need LASIK. I come in, you give me the once over. I definitely need it. We get together tomorrow and do it. I pay cash for that.
Yeah.
What does that cost?
LASIK is not covered by insurance. I can't tell you that.
Okay.
It's very cheap.
Oh my God.
If you make like, it will cost around $200 to $250.
I spent $99 on dinner the other night. You mean
I just came back from New York. I'm telling you.
Yeah. Oh, please.
I spent a fortune there on food.
But a $9 bagel in New York is what you did. That's fascinating. Wow. And can I ask a question? Please.
Go ahead.
Go ahead. Let's not use the eyes as an example, but am I getting the same level of care as I would somewhere else?
In Egypt?
Yeah. Versus New York? If I get my hip replaced?
It depends. Yeah, if you get a hip replacement, definitely you're getting the same care.
Okay.
Like the doctors here are really good. What we like maybe defective in a bit is like the nursing. Like you're not always lucky with the nursing staff you have. Some are really well trained and some are like they're not that well trained, you know?
Yeah.
The nursing, they don't have like a system
to train nurses. It's almost like just a job you get.
Exactly.
Yeah. Wow.
Exactly.
Oh, that's interesting too.
So, but the doctors, like my cousin had a real problem with her back and she needed to see a neurologist and they gave her an appointment like after 8 months. I'm like, okay, just come to Egypt. I'll book you an appointment with the best neurologist we have. Go and see him and then go back.
Yeah.
You don't need to wait 8 months to see a neurologist.
You know, I have a friend who needed just an iron infusion in Canada and it took like a year.
Exactly.
Yeah. Dragging ass the whole time, like exhausted, brain fog, blah, blah, blah. And it's just takes forever. And the way it was explained to me is that I guess Canada does it on the "Are you going to die" system. So like the closer you are to dying, the faster you get to a doctor. But then people start with these small problems, and by the time they actually get to the doctor, they're in a much worse situation. Yeah, they're dying. Like, right. Like, I was like, that doesn't make sense. Yeah, it's something else. So access is really great.
Yeah,
okay. All right.
Exactly. Like, I think this is a really good thing. Like, if you can see a specialist, and if he needs an MRI, he tells you go and have an MRI, you can have it the next day and then send him the report the day after. It's that fast.
Well, listen, if you have good insurance here, you get treated well too. This is going to be a weird example, but I woke up one morning a couple of years ago and my toe hurt terribly. Like to the point where I thought, did I wake up in the middle of the night and like kick a wall or something and not know it, And I thought it would go away and it didn't. And it got worse and worse. And I ignored it for a very long time, just thinking like, it's a ligament or something. It'll get better. Who knows? But once I decided I can't take this pain anymore, and this is, stopping me from walking correctly, I have to go do something like that. I called the guy. The guy said, I got an appointment the next week. I came over. He took a look at it. He goes, I can get you on the schedule. I had a surgery 3 weeks after I called him.
Okay, that's great.
And that was fine. But it's because I have good health insurance. So when they see my health insurance, they see, oh, we're getting paid for this. And now you're on the schedule. You know what I mean? I wonder what that toe surgery cost. Do you know? I don't even know. Like I have no idea what the doctor made.
I know in the States, you don't even look at the bill. Like the insurance is paying that.
I don't even know if I got a bill. I already put out enough money with Arden at the beginning of the year that I didn't even owe anything for the doctor's visit. Like I just walked in.
You were out of the deductible.
Yeah, I was out of my deductible already. So I was never bothered. I bet you if I went and looked at that, I bet you that doctor made 40 or 50 grand doing that thing. You know what I mean?
Okay.
Yeah.
Yeah.
You got to come over here, just do a couple LASIKs and go home.
Like I told you before, like we lived in the States for like a year and a half.
Right.
My husband has his fellowship there in Houston, a Methodist hospital. Mm-hmm. And we had good insurance, but thank God we didn't like in that year, we didn't need to use it.
Yeah.
Yeah. So we have like limited experience with it, but it was a good year. Like we had a good year.
I was going to say, you should come over here, do 5 LASIKs and go home a king.
Yeah, I guess we should do that. Not that easy.
It's not. You can't practice medicine outside of Egypt?
No, like in the States to practice medicine, you have to do like what's called the USMLE. This is what my husband did. And then you have to have like, it depends on the state. Each state has its license. You have to have the state license to practice.
It all seems like a scam to me. Basically, you have to come here, pay $500,000 to get educated so that you can go charge somebody 40 grand to fix their toe.
Whatever.
That's what it sounds like to me.
Yeah, whatever. But anyway, this is how it works here. And I think it's been good for us, like having his doctor available when we were locked down. And we didn't have to take him to the hospital to give him the care he needed. So I think this was a good thing.
Yeah. Well, no, it really is. This whole conversation is incredibly interesting. How involved did your mother-in-law try to get involved when your son was diagnosed?
She tried at first a bit, but right now she's not involved at all. Like in the beginning, she's like, okay, what are you giving him? What he's doing? But, by that time she's already in pension. I don't know what you...
Retired.
Like... Yeah, she's retired. And she wasn't oriented, like when I started mentioning Omnipod and Dexcom, she's not oriented with these devices at all. Like I told you before, we don't have them in Egypt. And that's a very interesting topic. Like in the area I live, we have like a 13 Starbucks and a 12 McDonald's, but we don't have Omnipod in Egypt,
Yeah.
Like, how is this more important? How is it more important to franchise Starbucks and have like 12 just in the block we live, and then we can get access to like important medical devices,
I think that these companies just don't know how to do business in other countries. You know what I mean? To go set up somewhere else is a big undertaking. I mean, Omnipod they have an office, I think, in England now.
Yes, they do.
Yeah. And so, but I actually have a number of times met, I think I've had dinner once with the person who Omnipod sent to England to like set the whole, like to get the thing rolling. It's a big undertaking. You've got to move people, uproot people, send people over there to learn how to do business in another country and then get the entire things. It's a hell of an undertaking.
I guess the other way would be like what happened in Turkey, where some businessman or whatever decide to like franchise the company and be in control of it in his country, you know?
It's funny. I've never heard of that before. I'm glad it exists, but I don't know about it.
It does. But the point is, I think in Egypt, it would be not worth it to invest in something like that because, like I told you, most of us will pay out of pocket for it. And by the time it comes here, it will be even more expensive than the state. So that would be like a financial burden for most of the Egyptians.
Yeah, to pay a middleman.
Yeah, you need to get the insurance companies on board. So that's when it can like be financially good for the company.
Accessible to people there.
Yeah, exactly. So I think it's a big thing to do right now, but it's just, it's a struggle for us using the Omnipod. I have 4 or 5 friends who use the Omnipod for the kids and we're all struggling together. And whenever we find the source, I keep calling them and I'm like, hey, I found it in Turkey. So we can go there and get our stock, or we found this website or that guy who outsources them from the States and whatever.
Yeah.
So it's a real struggle that I feel like we need to get out of,
It's interesting that another country doesn't knock off medical supplies. You know what I mean? Like copy them, like companies that are outside of like caring about, you know what I'm saying? It happens all the time.
Yes, I understand.
Yeah.
But I think this is like very advanced technology for somebody to just knock it off because it doesn't work properly. You're killing people.
Yeah. Well, I assumed that somebody wouldn't care about that and they would try it. I just found myself thinking it's interesting that that doesn't happen. Maybe countries stay on top of stuff like that so that nobody gets hurt. But there's got, to your point, there's got to be a way, right? They make the damn things. They know how to make them. If there was more countries they could send them to, they could build more infrastructure and make more. I'm sure they'd be happy to make more if they could sell more. I guess it's just that's the process of actually distributing it once you get to the country and understanding all the rules and regulations there and working within them. I guess that's where the hard work comes in.
Yes, exactly.
Okay. Well, that's something. How comfortable are you a few years later that you know what you're doing? Like, how's your son's A1Cs? Does he do better than your husband, for example?
Yeah, definitely. His average is around like 6.2 to 6.5.
Oh, that's wonderful.
But his time in range is not always perfect because he's really young and I can't stay on top of it. Especially in this last year, he'd go and eat something and not tell me. Before, not everything was accessible for him. And maybe when he grows up, he would understand that he has to tell me before he eats. But right now he can just go and grab a biscuit and not tell me,
Yeah.
So I have to be on top of things. Definitely Omnipod 5 would have helped with that, but it's not available in Turkey and it would be more of a financial burden for us right now. So we're waiting on it a bit.
Do you ever consider doing one of the do-it-yourself algorithms?
The looping?
Yeah.
Yeah, I was thinking about doing it that summer because I have a couple of friends who's been trying with it and they did not succeed yet. So I'm waiting for them to succeed. And then they tell me exactly what to do. I didn't have time, like maybe in the summer when he's at home with me all the time, we can do that. But it would be very difficult when he's coming and going back and, like he spends like half his day in school.
Yeah. Yeah, no, I understand. Arden's using IAPS now. But the truth is that if somebody wouldn't have helped me set it up, I wouldn't have known how to do it. It's got so many settings. It's like mind-boggling.
Yeah, I heard it's so difficult. So I need to take a time off and have him with me all the time and we can try that.
Yeah, I don't even understand. Like people are asking me now like to talk about it. I'm like, I don't even know what to say, to be perfectly honest. Because
what happened?
Yeah, because Arden's off at college and it's working so well that it doesn't need a lot of intervention from us.
Wow.
And at the same time, I don't know how I got to the settings because Mike, who's been on the podcast, he was just like, make this one that, make this one that, turn this to that, make it this number, this, and then let's assess it and it'll work. I think I put it on her and made some changes to her insulin sensitivity and carb ratio. I think I made her carb ratio weaker and her insulin sensitivity, I had to make it stronger. And then it just started working. And I was like, all right, well, okay. But now she's actually using, I don't know how much I've spoken about this yet because it's pretty new. She's using a GLP. So right now it's Ozempic.
Okay.
Yeah. Her doctor wants her to switch to Mounjaro at some point, but we were having trouble getting it. So she's using Ozempic right now, but not even like a therapeutic dose. She's using like 0.25, is it milligrams maybe?
And did it help her? Like, did it help? Because I was actually thinking about that for my husband. I was like, I
Radwa,
think
you have
Ozempic
no
would be.
idea. Like, I can't wait to do an episode about it to really talk about it. But
Yes, please.
oh my God, my rough math tells me that Arden will use over 11,000 fewer units of insulin in 2024.
Wow. Okay, because I had this idea. I used Ozempic to lose weight for a couple of months.
Mm.
Okay, and I saw the results, and I went all over my husband. I was like, I think you would really benefit from Ozempic. Like, you don't have that. His diabetes is not that bad. The one he got at 26.
Mm.
He doesn't go like crazy high. He actually, when he started going to the gym, we went very lower with his doses recently. So I was like, if you go on Ozempic, I think you can just keep up with the basal and need the NovoRapid to a minimum. So I've been pushing him about it, and he's been resisting for a while. But after you said that, oh my God, I'm going to be all over him.
Her daytime basal went from 1.1 an hour to 0.7.
Wow.
And her spikes are, when she gets a meal spike, they're much lower. I used to say, I would tell people, right, like, I think of 180 as high. I think of 200 as a spike. We really screwed up. And now I think of 140 as high and 180 as a spike that we screwed up.
Wow.
She's coming back down more gently, quicker. Like, this morning was her first day of college for, whatever semester this is and some quarter this is for her sophomore year. So I watched her. It's fascinating. She's 700 miles from me. And I knew what time she was getting up and going to class this morning. So while she was heading to class, I sent her a text. I said, good luck this quarter. And so I know she's on her way to the building. And I'm watching her blood sugar go from like 110 to 120 to 130. And then the algorithm's like, oh, what's happening? It stopped her at 149 and it brought her back down in like 2 hours. So It's a pretty big adrenaline rush that she got. Arden takes school very seriously. So she's like, I think it's stressful for her. So she gets this big push that the algorithm is not expecting. It pushed it back down. She went from like 119 to 149 and back down again. And I'm wondering what's going to happen now during the day, because school's, she's back at school. It's different now. I don't know what her schedule's like yet. Like, I got to let her settle into her schedule a little bit before we can make changes. Her last 24 hours, I would consider not good. And there's been one spike to 180. There's been a couple of stretches where her blood sugars were, hold on, let me look so I can really tell you. Okay. A couple of stretches where they were in the 140s after 2 different meals. And other than that, it's been pretty much between 120 and 94, actually 120 and 70 for the rest of the time in the 24 hours. So I would say 20 of her hours are between 70 and 110, and maybe 4 hours that were up around 140 and then one spike. That was it. Of course,
with Omnipod DASH, with my son, we don't get these numbers. Like, he spikes to 220 and 230 sometimes, especially that we can't always do pre-bolusing, you know? I can't be sure if he's going to eat his meal or not. Like, he's not that helpful yet.
Right.
So, but definitely having something like the Omnipod 5 with me or an algorithm would definitely be of much help. I'm looking into it this summer, but the Ozempic, I'm definitely pushing it
for your husband.
My husband as soon as he comes home.
Well,
today.
I mean, not just that. From March to now, to January, I've lost 38 pounds with Wegovy, which is Ozempic, right? And last week, my endocrinologist, who's helping me with this, is also the same person that helps Arden with her diabetes and the rest of my family with their thyroid stuff. She's like, let's get you on Mounjaro if we can. And I was like, okay, which is now called Zepbound for weight loss. So she wrote me the script and we took it off, and they were like, hey, we can get that. And I was like, great. So I shot the first Zepbound like a couple of days ago, and I'm assuming there's going to be like a period of time where, something, I don't know what the hell's going to happen. The Wegovy for me was good, obviously, but I had definitely plateaued. I was not going to lose any more weight. I still had some stomach acid stuff. Oh God, I can't, Radwa, I'm so sorry to say this to you. I haven't had a nice firm bowel movement in a while.
Yes, I was going to ask you about that.
Yeah. Yeah. It's not enough to like make you go, oh, I don't want to do this because you're losing 40 pounds. But at the same time, I was like, I would like that to go back to normal.
Yeah, to go back to normal. The Manjaro doesn't have the same side effect?
She said that I very well might not see the bowel movement side effect, and that it also has something in it that helps with stomach acid. So she's like, I love this for you. Let's try this.
Yeah, it does. And it actually, like, from what I heard, it helps you, like, the Ozempic helps you to lose around 12% of your body weight, but the Manjaro helps you to lose 18%.
Yeah, that's what I'm
Yeah, it's
understanding
definitely
too.
stronger.
I'm hopeful. Like one way or the other, I need something just for management. And this is not about, like, I know people who don't understand it would think, oh yeah, you have to shoot something to keep yourself from eating a bunch of food. It's not like that. I'm at the part with the GLP where I can eat fine. Like I'm not limited about how much I can physically eat if I want to.
Exactly.
I am making different decisions, but I think those decisions are more because I like better how I feel and how I look. So
exactly, like I told you, I'd had an experience with it, and I was like, this is not bad. I don't feel like I'm not depressed. I'm not like I don't want to eat something and I can't eat it. When I want to eat something, I do eat it.
Yeah.
But it helps me with controlling a lot of like the unnecessary cravings that you get, and it helps you to keep yourself in shape.
My wife says that it stopped the food noise in her head.
Exactly.
Yeah. She said she'd wake up in the morning and the first thing she would think is, what am I going to have for breakfast? And then she said while she was making breakfast, she was thinking about lunch. And she's like, that is completely stopped for me. Now, I don't have that. I think I have some sort of a deficiency that it made up for, because my body is operating way better right now. And it's got very little to do with what I'm eating being different. So yeah,
exactly.
It's pretty great. But back to for type 1s, to be clear for people who are listening, our insurance is not covering Ozempic for Arden, and our doctor is helping us get it from somewhere else too. So we're paying cash for it, but it's very doable because it's cheaper where it's coming from. And on top of that, she's not really using much of it. So the pen's lasting forever for us. So,
okay. So she uses like a very small dose.
The smallest dose. And it's and the doctor's like, we're not going to move this up if we don't have to. Like, look what it's doing for her. By the way, also, it cleared up her acne by like 80%.
Wow.
Because we think Arden probably has PCOS.
Okay.
And so now we're waiting to see. This is her. Again, I feel so bad. Arden, I'm sorry if I'm dead and you're listening to this 20 years later. I'm sorry that I'm about to say Arden's about to get her second period since she's been using it now for like over a month. Sorry, Ards. And I'm hoping that it's a less impactful period, because Arden can have heavy, painful periods. So I
feel bad for Arden right now.
Dad, she don't care. And so so if that makes that even better, well then hell, like now it's and we are seeing that online, which I'm going to keep saying over and over again. There are women online who have not been able to be pregnant for their lives, who have PCOS, who are using Wegovy, Ozempic, those GLP medications, and they're getting pregnant.
Seriously?
So, yeah,
okay,
yeah.
This is the first time I hear about that.
Yeah,
I know.
There's a group of women talking about it online. I saw a group of people on Reddit talking about their connective tissue disorders.
Okay.
I can never say it correctly, and that slows me down when I'm about to say it. Hold on a second. God, it's the Danlos. Do you know what that is? It's an autoimmune.
Danlos? Ehlers-Danlos?
Yes, that. Okay. I actually saw a Reddit thread of a bunch of people with that who said that they think their symptoms are getting better on GLP. Now, I don't know if they're losing weight, it's putting less stress on their joints, and maybe it feels better because of that. Not sure. Or if it's actually helping them with it somehow. I have no idea. But I mean, when you start seeing 25 people say, oh my God, that's happening for you too, like, that's crazy. You know what I mean? So
yeah, that's crazy. And it's the first time I hear about it too.
Yeah, you got to pick around on the internet to hear people talking a little bit about things. But I 1,000,000% believe that if terrible people with, money focuses don't get in the way, you're going to see GLP medications that given to people with type 1 in great numbers over the next couple of years.
Yeah, I really hope that, because what I've been seeing is like the opposite. Like every like week, I find an article about somebody's like Ozempic killed my wife, and then you read the article, and Ozempic did not kill his wife. You know,
Well,
she just died. She
yeah.
was on Ozempic, but she didn't die from Ozempic. You know, like, I don't know what's wrong, but like articles keep popping up for me, like on Instagram or from US Daily or whatever, and it's always about how side effects of Ozempic, you know?
I don't want to be a conspiracy theorist, Rodwell, but I'm assuming that article is planted by like a sugar manufacturer who's like,
Most probably.
oh God, these people keep shooting this GLP. We're going out of business.
Exactly.
Honestly, I mean, I don't, obviously I have no idea, but if their cravings are curbed and they're losing weight and having the experience I'm having, which is, I prefer to feel like this than to eat that, or, even just the quantity. I told you I spent $100. My wife and I went out to dinner the other night. I got this a beautiful bowl of pasta with shrimp and crab in it. It's a spicy, had a red sauce. It was really good. I really loved it. I did not finish it.
Exactly.
Yeah.
But that's good. Like you get to eat what you like, but you don't have to like overstuff yourself.
Exactly. And it's that overstuffing, because there's no way I wouldn't have finished that without Ozempic.
Exactly.
Yeah.
Like when I was on it, I'm a person who's like, my favorite food is ice cream. And like my kids always make fun of me. If I get a pint of ice cream, I could finish it while I'm sitting on it. You know, like I don't stop eating ice cream until it's done. But now I get to eat, like if I crave ice cream, I eat it. But I definitely can't finish the pint. It's like a few spoons and I'm done and I'm happy.
Exactly.
You know?
And my joints feel better too, because I've lost weight. My ankles feel better. My feet feel better. Like, all that stuff that I before would be like, oh, I'm old, that's why my heel hurts. That it turns out my heel hurts because I was carrying around an infant with me on my ass. You know what I mean? I feel much better now. My wife looks amazing and feels much better. This whole thing of people like making fun of it and everything, they really don't understand what they're talking about. So
most probably, yes.
Yeah. But I also get them feeling pissed. Like, imagine you're skinny and you've been like stopping yourself from eating stuff you want for years. And you're like, wait a minute.
Exactly.
That's not fair. I had to have willpower. But it wasn't willpower though. Like, I don't know another way to say it. Like, it's an unconscious thing that happens.
Exactly.
Yeah. It feels like you're being drawn by your own chemistry. I don't know another way to put it. Yeah.
Yeah.
Anyway, is there anything we haven't talked about that we should have?
I guess not. I just like yesterday, I was just listening to your wrap up, how sad you were that day. And all I wanted to tell you, like you were talking, I'm just helping the top 10% of the top 10%. Believe me, like you're doing a lot, like not just in your country, like everywhere for the type 1 diabetes community. And I just wanted to get that through to you. I know you hear that a lot, but just hearing the wrap up yesterday made me feel like I have to tell you that.
You're very nice.
Like
Thank you.
Really, when I started listening to your blog, I just listened to the first episode, the one where you were talking about the background music that was made by your kid's friend.
Mm-hmm.
And you went from there to here. And you need to remind yourself of that, like every time.
Well, I got a lovely note this morning from a gentleman and that said something similar. He said he heard an episode recently that just really changed how he thought about his own health and that he was doing better. And it's because of the podcast, and he heard me. So for people who don't know, like at the end of the year, I always do like some episode where like, I think like last year I talked to Jenny. Like I realized I'd never talked to Jenny like she was a person. We always come on and talk about like management stuff. And this year I wanted to just kind of do a wrap up because it's been a kind of a difficult year, like behind the scenes. Apple made some changes to their podcast app. It impacted downloads of back catalog stuff, which is going to impact my overall number. And I don't know, it took away my, I don't know another way to put this. I need something to get me up in the morning. We all need something to get us up in the morning, right? And so I use helping people and reaching people as my measurements, right? If I'm helping people, good, that's our goal. That's our only goal. Actually, that's, if anybody needs to know the secret to building something successful, I only focus on helping people. If I help them, it'll grow on its own. I don't have to worry about that. And then, but the other side is the growth. And when I plateau or if the growth slows down, I don't see it as, oh, I'm not succeeding. I see it as like, oh, it's not working. Like I have this information that I know helps people. How am I not figuring out how to better get it into other people's hands? And I don't know another way to explain it other than winning makes you feel like playing, if that makes sense. So
yeah, definitely. Yeah. But believe me, you're reaching a lot of people, even if you can't see it. And when you talked about like for somebody to listen to your podcast, they have to be educated well. People have to look for it.
Yeah, it's not up to me.
Like people have to really care to start looking and listening to a podcast about their health or about how to do things better. Or, we have a lot of diabetics here in Egypt. After my son's diagnosis, as an ophthalmologist, I used to get a lot of people to check their fundus, for example, regularly because they're diabetics. And I'm like, yeah, hi. And how long have you been diabetic? I check their fundus. They're good. And I just let them go. Now, whenever I see a diabetic in my clinic, I just keep educating them. Like, do you have a CGM on? Do you have a pump on? What was your last hemoglobin A1C? I think you should listen to this podcast. Like, if they have good English, I keep recommending your podcast to them. Like, sometimes stuff happens that you can't see.
No, I know.
You know what?
And the crazy thing is, Radwa, I know that's happening. Like, I'm really aware of it. To be clear, so everybody knows what I'm talking about, the average, this is going to sound ridiculous, the average download for how do I say this? I get a certain amount of devices every day that come on to the podcast. They are now downloading, I think it's 0.7 fewer episodes per device per day, but I have a lot of people listening and 0.7s add up pretty quickly. And so it's the same amount of people listening. Like that hasn't changed. They all are, if they're subscribed, they get the latest down episodes. Everything works. They don't see the back catalog as much. And that's going to hit my overall number. Like it won't hit my new downloads for new episode number. Like advertisers are still going to be happy is what I'm saying. But I'm not like leaping forward the way I was before. And that
you're not where you want to be.
It was exciting for me. Like, I don't know another way to put it. Like, it gets me up in the morning. Like, I'm going to go win. Like, that's how it feels when I get up in the morning. Like, as crazy as it sounds, and I do hope this doesn't sound it's not callous. I don't feel callous about it. But when 4 people a day tell you they saved your life, or you saved their life, you don't get the same jolt out of it anymore. I really don't know another way to say that. Like, do you understand?
Like, it's become your regular. Like,
yeah, like how many people have looked at you in your life and said, "Oh my God, I can see again. Thank you." Right? And the first time someone says that to you, like you took their cataracts out, for example, you're probably like, "I'm a goddamn miracle worker. You're welcome." And then the 1,000th time somebody says, "Yeah, I know. I moved the cataracts. You're fine. You can see now." And but it's not dismissive. I don't feel dismissive about it. I'm thrilled every time somebody tells me. It's almost like gambling. Like I don't get as much of
I was going to tell you, it's almost like drugs. Like you have to get a higher dose to get drugged.
Yeah, right. Basically, I don't get jacked up the way I used to when somebody says my A1C was this and that. I cry more now than the excitement. I used to get excited like I'm doing it, and now it makes me sadder. But like it's almost like I'm feeling their emotions more now when it happens. Like I got a note this morning that, you know what, I'm not going to identify the person, obviously. Okay. And it was from a man, which actually, it was interesting. It struck me differently because guys are not usually very
emotional.
Yeah. So if you hear this, sir, please just know nobody knows it's you. But it says, "Hey, Scott, I don't normally do this, but I thought I needed to privately message you when I'm all caught up on new episodes. I scroll through past ones that I haven't listened to before. I happened to randomly click on 1032 Loss of Liberty. And I just wanted to drop you a quick line to say that I appreciate everything you do for me as a type 1 diabetic. Liberty's story of her husband was eerily close to mine. I recently got my health back on track, got an insulin pump, and started listening to your podcast a little over 3 months ago. Although I don't have nearly as many health issues as he did before he passed away, the mental health issues, almost losing my family, and some of the medical issues are identical to my story. This episode hit me like a blow to my head of what could have happened to me. And then as I'm reading this right there in bed this morning, that made me cry. Like I like emotional. I know you must get tired of doing this sometimes, but I just thought I'd let you know that what you do helps me every single day. And hearing that episode today gave me more motivation to continue on my path. Thank you again for everything you do. It's much appreciated. That made me cry this morning. Before I would have gotten it would have felt like I don't know, but I'm assuming cocaine feels like I would have been like, yes, I did it. I said a thing. It helped this guy. I would have been excited by it. Now I'm just touched by it. I was using the numbers to get my jolt. And anyway, Tim Cook.
I hope this year is much, much, much better for you.
I also want to point out that I did 5.6 million downloads last year. So it's not like it was bad.
No.
I feel stupid. I'm not complaining, but I feel that's just how I feel. Like, so I got on in that episode and I started talking about it. I wanted to do this episode at the end. It was like, we did 5.6 million downloads this year and everything was great. And I felt sullen, and it's how it came out. So I feel bad because everybody's reaching out to me to tell me it's okay now, but you're very nice. Thank you.
This year is going to be a lot better.
Oh God. If Tim Cook gets out of my way, his damn Apple app, what are you doing here? Yeah. Cut me a break. I'm trying to reach people. And by the way, this series, like taking the numbers out of it for a second, the real problem is that I need people to hear those back catalog episodes so that they're helped, so that they have a success like this person who wrote to me did, and that they see a benefit for their health, and then they tell somebody else about the podcast. If you never get helped, then you won't have the success. If you don't have the success, you won't pass it on. And word of mouth is how this works.
A year and a half ago, this is how I came across the Diabetes Pro Tip episode. I had tons of episodes in front of me and I didn't know where to start. And then when this popped up, I listened to it. I'm like, oh, there's a Diabetes Pro Tip. So I kept looking for them and listening to them. They really helped.
Oh, I'm glad. That series is, I know it's out of my head and Jenny's head, but it's one of the things I'm more prouder of. Like, I know you listen to that series, you can get an A1C in the low sixes, no problem.
Yeah, it's really good. Yeah. And it's to the point. So
yeah, no, it's just conversational enough, but it's technical enough. It strikes a good balance. It really does.
Exactly.
I'm glad it helped you. And thank you for telling me.
Thank you.
Yeah. If you would have wrote it to me, I would have cried in my bed, just so you know. Like an idiot. Anyway, hold on for me for 1 second. This was terrific. Thank you.
Sure. Thank you.
Hey, don't forget to check out touchedbytype1.org. Go to their programs tab and find out about that huge upcoming event. It's an in-person event in Orlando, Florida. It's absolutely free for you and anyone else you know who would like to attend. Touchedbytype1.org. And if you can't come to Orlando, still check them out on Facebook and Instagram. I want to thank the Eversense CGM for sponsoring this episode of the Juicebox Podcast and invite you to go to eversensecgm.com/juicebox to learn more about this terrific device. You can head over now and just absorb everything that the website has to offer, and that way you'll know if Eversense feels right for you. eversensecgm.com/juicebox. If you're not already subscribed or following in your favorite audio app, please take the time now to do that. It really helps the show. And get those automatic downloads set up so you never miss an episode. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. If you're living with type 1 diabetes, the After Dark collection from the Juicebox Podcast is the only place to hear the stories that no one else talks about. From drugs to depression, self-harm, trauma, addiction, and so much more. Go to juiceboxpodcast.com, up in the menu, and click on After Dark. There you'll see a full list of all of the After Dark episodes. The episode you just heard was professionally edited by Wrong Way Recording. WrongWayRecording.com.